Joining us now on the Megacast is Dr. Russell Faust. He is the medical director of the Oakland County Health Division, joining us on today's edition of the Megacast. Dr. Faust, thanks for being with us today.
Good to see you again, Tyler. Thanks for letting me provide an update on flu, RSV, and COVID.
Yeah, it's definitely a very interesting time, I would assume, for public health officials, as we have these three unique but also somewhat similar viruses, especially between COVID-19 and the seasonal flu, and how they spread in our community, and having all three of those really be going around at the same time. Let's start with COVID-19. Where are we at in Oakland County? We know that from the Michigan Department of Health and Human Services, case numbers have been on a slight rise, same with testing numbers, but deaths have been down, at least over the last week, quite significantly. What's the status in Oakland County?
You know, I know we're all tired of hearing about COVID, so I won't spend a lot of time there, but let me just say that BQ1 and BQ1.1 have taken over from BA5 as the dominant strains. This simply means that the BQ strains are better at transmission. They're more infectious. But despite those strains being better at transmission, hospitalizations and deaths have remained flat for the past 4 weeks. But this is no time to relax. COVID is not gone. According to the CDC, on average, 300 Americans die and 3,400 are hospitalized with COVID-19 every day. And Americans are not as well vaccinated or boosted as we see in other countries. So that remains a concern.
And on the seasonal flu front, the fear coming out of the thick of the COVID-19 pandemic, both last year and especially this year, has been more interaction between the community, maybe a little bit less vigilance on the community's part for the spread of these viruses, and especially that people may be a little more lax in their efforts to be vaccinated against the seasonal flu. How is that having an impact at this time on Oakland County, or at the very least, what is the expectation for the severity of this flu season?
Well, you know, flu activity has started early this year and is elevated across the United States. Hospitalizations are highest in adults age 65 and older, followed by children younger than 5 years. But flu hospitalization rates right now are higher than at this time of year during every flu season since 2010. So we do encourage folks to get their flu shot. It is never too late.
And in terms of that flu shot, what are the similarities between that and vaccination from something like COVID-19 or other viruses that we see spreading throughout our community? Because there seems to always be that crowd in the community that says, well, I don't need to get my flu shot. I got it last year. I got it a couple of years ago. I never get the flu. So why should people consider, or seriously consider, getting their flu vaccine every year, and especially in this season?
Yeah, well, this season, now that we've been masked and distancing for a couple of years, folks, let's say the immune systems are a little bit behind. And so, you know, the recommendation is for the flu shot, specifically everyone 6 months and older should get the shot, especially those with chronic medical conditions like heart disease and diabetes. But so far, only 1 in 3 children in the U.S. have received this season's flu shot, and only 1 in 3 pregnant women have received this season's flu shot. So that's certainly a concern.
More information can be found on oakgov.com. You can go to the Oakland County Health Division's direct COVID-19 website from our website, civiccentertv.com, on our local news page. A link at the top of the page. Just click on what says Oakland County. That will take you directly to their COVID-19 specific web page. Dr. Russell Faust is with us on today's edition of the Megacast, the medical director at the Oakland County Health Division. We've heard a lot also this season, especially over the last really month or 2 months, about RSV, particularly how this particular virus is affecting our kids, especially young kids, and has been quite severe and quite dangerous in many cases. Give us some background on RSV and also why it particularly is affecting the younger population.
Well, RSV activity does remain high, but varies across the U.S. by region. And for example, RSV, or respiratory syncytial virus, positive tests are decreasing in the South and Southeast right now, beginning to plateau here in the Midwest, including Oakland County. So we're actually currently at about the same level for this time of year as we were in 2019, so pre-pandemic. Let's talk about RSV hospitalizations, which is what we've been hearing about for children. So children aged 4 years and younger have the highest RSV associated hospitalization rates. It's usually the leading cause of hospitalization among children under 1 year in the US, so that's not unusual. And in fact, nearly all, or 97% of children, are infected with RSV by age 2. Overall, 2 to 3% of all infants will be hospitalized with RSV. The issue right now is that women who were pregnant during the last couple of years, when everybody was masked and distancing, normally would have been infected with RSV. For adults, it's often not a big deal. It's often asymptomatic or like a cold, a common cold. They would have passed on antibodies or passive immunity across the placenta to their developing babies. And those infants would have been somewhat immune to RSV. We didn't really have that for the last couple of years. And for a couple of years, children were either schooling at home or wearing masks and distancing at school. So we've had that release. Everybody's darn tired of COVID. I get that. And we're all tired of COVID. But as people go back to work, go back to colleges, go back to school, they're bringing home RSV potentially and infecting those younger children. And so we have 100 pediatric beds in Oakland County, and 75 of them are currently occupied, not all with RSV, but many with RSV. So that is a problem. We've talked about the flu shot. We've talked about COVID vaccination. There is no vaccine for RSV yet. It's promised for next year. So we really should talk about prevention and note that the same preventive measures work for all respiratory viruses, influenza, COVID-19. So a couple things: stay home if you're sick, avoid others who are sick, cover your coughs and sneezes, wash your hands frequently for at least 20 seconds with soap and water, stay up to date on all other recommended vaccines, and when in doubt, wear a mask. We know that masks work.
And on all that, those are proven to be rock solid or preventative measures. Not 100%, nothing really is, but it's the best you can do to prevent the spread of these kinds of viruses. But in the case of parents in particular, it's tough for them to avoid these sort of interactions with their kids, and they're going to be at least at somewhat of a risk, even if they are taking all these precautions in their lives, both around their children and around other people. So for parents especially, Dr. Faust, what should they be focusing on? What should they be looking out for in terms of symptoms of developing RSV in their kids to get them that treatment as early as possible to prevent severe symptoms and outcomes?
Yeah, absolutely. So let's talk about when to seek medical care. That's what we're talking about. For children, any trouble breathing, fast, rapid breathing, retractions, seeing the ribs pull in infants and children when they're inhaling, blue or gray face or lips, chest pain, severe muscle pain, where for COVID, some kids may have severe muscle pain and refuse to walk. For any illness in little ones, dehydration, no urine production over 8 hours, no tears when crying, any seizure, fever above 104 degrees Fahrenheit for most children, or for infants younger than 12 weeks old, any fever. Those are the things to look out for and get your child seen.
More information can be found on the Oakland County Health Division's website. Go to our website, civiccentertv.com. On our local news page, you can click on the Oakland County Health Division link there. It'll take you to the COVID-19 page. We can also navigate directly through their area of the Oakland County website to find more information on RSV, COVID-19, the seasonal flu, and more health-related issues in Oakland County. For more information from the CDC on RSV, go to cdc.gov/RSV, cdc.gov/RSV. And this is not just something that affects kids, it can affect others as well. So in terms of what people should be on the lookout for, and Dr. Faust, in delineating whether it's RSV, maybe the seasonal flu, or COVID-19? Are there certain symptoms that they can look out for that would indicate it's more along the lines of RSV? Again, especially if they have kids in the home and they may be transmitting this to their kids in those cases.
Despite the fact that we're seeing so many pediatric cases right now in our emergency departments and urgent cares and being hospitalized, that isn't really the age group that's at greatest risk from RSV. So it's those who are 65 and older who have other chronic ailments. And the things to look out for, again, are trouble breathing, pain or pressure in the chest, any elderly person with new onset confusion and they're struggling, they're a little bit ill, inability to awaken or stay awake, and again, pale, gray, blue-colored skin, lips, or nail beds. And I do want to point out, I appreciate you calling attention to our oakgov.com website, but also I should provide the nurse on-call line available Monday through Friday, 8:30 to 5, 1-800-848-5533 for anybody's questions.
More information also on the direct link, oakgov.com/health, oakgov.com/health. And it will also provide information on the nurse on call hotline, COVID-19 boosters and flu shot clinics, COVID-19 vaccination, preventative steps you can take. All that information can be found on the Oakland County Health Division's website, oakgov.com/health. Dr. Faust, a few more minutes with you today before we'll say goodbye and move on with today's program. Anything else that we should be keeping aware of at this time in Oakland County in terms of health care related issues?
No, I think the next time we chat, we should maybe talk about polio a little bit. But right now, I'd like to re-emphasize, if you're sick, stay home. Stay away from others who are sick. Cover your coughs and sneezes, wash your hands frequently, stay up to date on the recommended vaccines. A recent study has shown that regardless of the kind of variant, which variant is going through a country, the country's vaccination status is the most important factor for the outcome. So let's get everybody vaccinated. I really appreciate the opportunity to provide these updates, Tyler.
Yeah, always glad to have you on to give us the updates, how it affects directly Oakland County, and some more context as well for the greater community here in Michigan and across the U.S. Dr. Faust, thank you.
Thank you. Have a good one.